Alright, my name is Tyler Dunnigan. I'm a therapist here at RestoraLife, and with me I have Robert Lewis, who has been a patient with us since the beginning of July. How are you doing today, Robert?
Super, good.
Alright, doing good today? So,
yes.
Let's start with, how'd you hear about RestoraLife?
A friend of mine in our community had come to his seminars, and he came to see the director here, and when she looked at his x-rays, she said, you're too far gone, your hips are too worn out. When that was related to me, I was impressed that she turned him away. The honesty factor today means a lot to me. So I decided I would get my x-rays and I would come and have a conversation. When she looked at my x-rays for my knee, my left knee was bone on bone. It continued to swell. I couldn't walk that far. And Nicole said to me, you're the perfect candidate for our treatment. My body mass index was correct. I did not have excess weight, and my eating habits were good. So I came and I had the treatment, and I wish I'd come years ago. Trust me, it's...
And that's tremendous. And like, let's see as a comparison, how was your pain when you first got here? How limited were you?
Well, the pain was more mental than anything, because I was restricted in what I could do. I figured I'm 71 years old. I figured, and I used to play semi-pro soccer. I've always been healthy. I've always been fit. And here I am. I couldn't walk hardly that far. My knee would swell, bone on bone, and I just didn't trust the physicians I had been messed around with before, and I didn't trust them. And this was, in my mind, a good alternative. It was worth a shot.
Okay.
And I'm glad I did it, because I think the decision I made and the procedure was, for me, was perfect.
All right. And speaking of procedure, what exactly did you have done when you got here?
I showed the x-rays. They said bone on bone. So then when I arrived, the doctor here they took my blood, they took the platelets, and with the stem cells, made a cocktail, and then injected into my kneecap here and this kneecap. This one hadn't really bothered me, but because I had relied on this one for so long, the fact that I'd worn that one out probably, so I decided to have both done at the same time, and my knee is stable. Actually, I went to Orlando, to Disney, with a group of my family, and we walked 6.5 miles. The lady had a pedometer on, and she's a health freak, and 6.5 miles, and my knee didn't swell. I was tired, but my knee didn't swell. And the next day, there was nothing wrong.
And that's tremendous. And you came in here and you got everything done. Now, were you skeptical at all about what was being done? Had you ever heard of PRP or stem cells?
No.
What you had done? You had not heard of that before coming here?
Never. It's when my friend told me that he came and he explained the procedure, and that he had been turned away because it wouldn't work on him. That honesty there prompted me to come to hear what I would be told. It does work, but it takes time, and you have to help it. You have to, if you can, lose weight and eat clean and healthy and drink good water, like you should have done anyway. You know, it's. I'm very glad. I'm very satisfied with the procedure.
And that's awesome. And it's a basis of comparison here. Let's say, what would you say on a scale of 1 to 10 when you first started treatment here? What did you think your pain level was at?
My pain, because my knees swell up every time I walk more than a quarter of a mile. My pain was huge because I was so limited in the rest of my life. Now, as I said, we walk 6.5 miles, and I play bocce, and I ride my bike, and I do a lot of stuff that I couldn't do before, and I'm able to do it. It's 4 months, and there's no loose spots in my knee. It's working. It is working.
No, and that's tremendous that you've seen that kind of relief. You know, walking 6 miles, that's definitely that makes most people tired. So the fact they're able to manage that now is tremendous compared to the beginning.
It amazed me. I said, "How far have we walked today?" And she said, 6.5 miles. I go, man. I thought the next day my knee would be locked up, like it would have been if I'd walked a quarter of a mile before. My knee would swell and enable me to move it because it was hurt. And it didn't. I mean, I think it's magic myself.
And was this something now that you've had this much success with it, is this something that you would recommend to your family and friends?
Oh, of course, definitely. But you know what? You have to help yourself in this life as well. And when people are overweight and all of that, they have to get. This is not the silver bullet. This is like nothing in life. There's no pill that can put you back to 18 years old. You know. So, but this is worth trying. It's worth doing. The people in my community said to me, "Who do you know had this done? How do you know that it's going to work?" Well, they're flat worlders. Right? They're still sick and unable to do stuff. I can do stuff. And they look at me now and they say, "Man, you're a different person from what you were 5 months ago, 4 months ago."
Exactly. Your success, your mobility, it all speaks for itself there.
Confidence but as I say, I eat well and I watch what I eat and I exercise and I do everything to help you guys, because this is not the silver bullet to fix everything instantly. Yeah.
Absolutely, and like you said, it's helping us further do our jobs, but it's also helping you in the long run. That's all that matters. That's what's most important to us here, and that should be obviously what's most important to you. And it's good that you've seen this kind of success. And Bob, honestly, it has been a pleasure treating you, and thank you.
Thank you very much. Yes, thank you too, Thomas.